Okay, good evening, everyone. Thank you for joining the Sexual Health webinar for the Bolder Healthier Champions, Community Champions programme. Today, we're going to look at sexual health. There are 6 parts to the presentation. Firstly, looking at what is sexual health. Secondly, why is it important? Then look at relationships. Then sexually transmitted diseases. Um, then looking at contraception, and finally to consider your role as a community champion and how you can incorporate sexual health and well-being into your work. So if we move on to the next slide. What is sexual health? So sexual health is an important component of our overall health and well-being for individuals, couples, families, and communities. And it encompasses staying well, having positive and respectful experiences, being free from coercion, and respecting everyone's sexual rights. And the point is that sexual health is just as important as other aspects of our physical health, our mental, emotional well-being, and how we operate in our communities and society. So who's affected? Looking after your sexual health is important, whatever age you are. And some statistics are in 2021, there were 4 million consultations at sexual health services in England, alongside 300 diagnoses of new sexually transmitted infections among England residents. And where we look at a comparison of how that impacts in Birmingham and our population compared to the national rate, we use a way of looking at how many people per 100,000 population. So in Birmingham, there were 485 new cases of STIs, sexually transmitted diseases, in those under 25, compared to the national rate of 619. So in Birmingham, we have a lower rate of infections compared to the national rate. And a report found that over 80% of those aged 50 to 90 were sexually active. And there's been a rise in infections, sexually transmitted infections in England among older adults. So I think perhaps the perception is that sexually transmitted infections only affect younger people is not the case. And we're seeing, obviously, with an aging population, more people are staying sexually active. And so STIs is a really important issue for us to be considering amongst older adults. Who's most at risk of poor sexual health? And that includes STIs, I'll refer to them now, and unplanned pregnancies. So these are pregnancies that people hadn't planned, and there are obviously lots of issues that relate to unplanned pregnancies. And the factors that impact on rates are access to education. If people understand and are aware of sexual health and information, what services are available, then that has an impact. But also about different groups in society and economic aspects. So living in areas of poor education, poor lower employment can increase risks of poor sexual health. Age is also a factor. So groups, young people, particularly ages 15 to 24, are more likely to get STIs. And those in particular groups, particularly those from gay, bisexual communities and those men who have sex with men. That's what MSN stands for, men who have sex with men. And the UK Health Security Agency, which is a national body that looks and is responsible for elements of sexual health, says that anybody who has condomless sex is more at risk of catching an STI. So obviously this includes condoms, include a range of methods, femidons, so that's the female condom, dental dams, which is a protection, a thin layer of polystyrene that goes across the mouth or the vagina to protect. It's a barrier form of protection. So those that are not using barrier protection are more likely to catch a sexually transmitted infection. So moving on. So why is it important that you look after, or we all look after, our sexual health? Well, not only does it affect our physical health, and we'll come on to again how that some of the implications of sexually transmitted infections, but it can also affect your mental well-being and emotional and social well-being. So looking after our sexual health helps to prevent infections, prevent unplanned pregnancies and future complications. And a key implication, health complication, can be infertility in the long term. So moving on. So relationships. What is a healthy relationship and why is it important? Well, healthy relationships are important to all of us for our emotional, physical, social well-being, whether that is with a sexual or non-sexual partner. It means you feeling respected, supporting when making decisions, regardless of our sexual health or emotional needs. And a healthy relationship, including a healthy sexual relationship, is built on trust, understanding, and open communication. Absolutely key founding blocks, building blocks to a good relationship. We've put this slide in. It comes from the Be Proud Trust, looking at what sexuality is. So it's the gender-bread person. And it considers 4 aspects to our sexuality. So those are identified on the diagram. So firstly, identity. So how we think about ourselves, our identity, what we feel about ourselves. And that can be expressed as whether we feel we identify as a woman on the left or a man on the right, or if we don't really identify as either of those. And this is the term non-binary. So it's not one, it's not the other, but it's non-binary. And so some people may feel that they don't identify as either and identify as agender or not gendered. So that's the first aspect. The second aspect in yellow is gender expression. So this is how we display or we show our sexuality. So again, we've got people expressing themselves in a feminine way, as a masculine way, or neither. So in the middle, androgynous. So people may not really express themselves in any one direction, but rather than being in the middle. And then the third aspect is our biological sex. So that's what we're determined at birth on the presentation of the sexual organs when the baby's born, the observation of genitals, but it's also then impacted by our chromosomes, our hormones, our genes, and our internal sexual organs. So that's the aspect of biological sex. And then the final aspect of sexuality is orientation, or attraction. So how people find themselves attracted to, whether they're attracted to women, to men, or again in the men, bisexual, pansexual. And I think it's important, particularly as we develop and as society is becoming more aware of these issues, just to be aware of those different aspects to sexuality. So if we move on, we wanted to look at consent, because this is obviously very key in terms of sexual health and sexual behaviour. And the Sexual Offences Act in 2003 defines consent as when a person agrees by choice and has the capacity to make that choice. And its consent is an ongoing agreement between partners to engage in sexual activities and should be communicated clearly. And I think the key point here is that individuals can change their mind at any time and withdraw consent. So moving on. So what does that mean? You know, again, how do we express consent? What does it look like? So it may be being enthusiastically saying yes, very openly, talking to the other person about what you want and what you don't want, and listening to them in return, and listening and respecting, checking with other people. As we said, it's ongoing. So is this still okay? Are you comfortable? Do you want to stop? And listening to non-verbal cues. So there's obviously what people are saying, what they're expressing, but there's also the non-verbal communication that also should be taken into account. So they don't necessarily mean consent. And respecting someone's choice at any point if they say no. Moving on. So what it doesn't look like is behaviour such as dressing in a certain way, flirting, accepting a gift, a drink. That is not consent or an invite for anything more and mustn't be misread. Consent is not someone being under the legal age to consent, and we'll come on to that in a minute, or someone who's incapacitated because of drugs, alcohol, or for any other health reason, and assuming you have permission to engage in sexual activity because it's happened or it's been done in the past. So can everybody consent? No, not everybody can consent, and specifically it can't be given by, currently in the law, anyone who's under the age of 13 years old and under, anybody who's intoxicated or incapacitated by drugs and alcohol, anyone who's asleep or unconscious, or anyone with a mental age of 13 years and below. And those are really important factors to consider, if considering any issues around consent, whether it was given if it wasn't. So moving on. And this is obviously very key in sexual abuse and violence. The whole issue of consent really is important, and that can happen to anybody, and can include any unwanted sexual activity, from touching without consent to full penetrative rape. And I think it's important, particularly if you are having discussions in your roles as champions, if you become aware that you think anybody may have been raped, abused, or physically, sexually assaulted, even if you're not sure, it's important to know what support is available. And we've listed there a number of organisations that people can seek support from if needed. So just to say, in terms of the acronyms, LGBT, lesbian, gay, bisexual and transsexual, that's what that term means. So we've got the links there. So if anyone wants to find out more about those organisations, do please click and have a look. And then I wanted to look at safeguarding issues. So all of us have a responsibility around safeguarding for children, young people, or vulnerable adults. And particularly if you think a child or a young person or an adult is at risk of immediate harm, you should dial 999. So that could be in your personal life, it could be in the workplace, or in your professional capacity, whatever your profession is. So we all have a responsibility. If you see it, then call 999. But if you want more advice or support and it's for children, then we have the Children's Advice and Support Service, CAS, or for the adult and communities access point, ACAP. So you've got the opening times there, the numbers, the websites. So if you have any concerns regarding safeguarding for children, it's CAS, and for adults, particularly older, vulnerable adults, so that might be people with learning disabilities or older people, people with mental health problems, then ACAP is there to support. And you if you notice any safeguarding issues in people in positions of trust or respect, then there are two contact points again. So these might be people working with young people. Oh, sorry, gone on. Say, for example, a youth worker or a social carer, then they're called the local authority designated officer, a LADO. And if it's for adults with care and support needs, then it's the social care contact centre. But I think it's really important, because if you are having conversations around sexual health, sexual behaviour, often you can observe or witness or hear things, and it's important to know how to report and how to get good advice and guidance. So moving on then, the fourth part of the presentation is looking specifically at sexually transmitted infections. So moving on, what are they and who can get them? A sexually transmitted infection is any sort of infection that can be passed on from person to person through sexual contact. And there are a number of different types. Some of these you may well have heard of: chlamydia, gonorrhea, HIV, genital herpes, genital warts, and syphilis. There are others, but these are the main types that many people will be aware of. And I think the point is anyone can get a sexually transmitted infection if they're engaging in sexual activity, but most infections are easily treated and testing is free and confidential. How are they spread? Different ways: through sexual activity, whether that be vaginal, oral, or anal sex, or other sexual contact involving the penis, vagina, mouth, or anus. They can also be spread from mother to child during pregnancy, childbirth, or through breast milk, through breastfeeding. And some infections can be spread through non-sexual means, for example, blood transfusions. And this was a real issue in the early days of HIV, where people did contract HIV through blood transfusions. But they can also be transmitted through cuts, open wounds, injecting with needles, and needle sharing. And if you want more information, then we've got a link there to the NHS website. Moving on then to testing. This is really important. And I think, any key messages, if you are engaged in conversations as a champion, important to know that testing looks after your health and the health of others. Most STIs don't have symptoms. So, for example, chlamydia doesn't have any symptoms and so can be passed on. Some of the bloodborne infections, hepatitis B and C, that is a sexually transmitted infection, there are no immediate symptoms. So it's important to get tested to know if you're infected, and then treatment will reduce the chance of future health complications, and also it gives you that peace of mind in terms of mental well-being. So when should I take a test? As a general rule, if you start a sexual relationship with a new partner, or if you want to, then it's a good idea to get an STI test. If you've had unprotected sex with anyone new, then again, we advise someone to take a STI test. And if you are not in an exclusive relationship, so just with one person, then it's recommended that you should go and have an STI test every year. So testing is provided through sexual health services, and it can feel nerve-wracking and it puts a lot of people off. But if you do go and approach a clinic to get a test, it's free, it's non-judgmental, it's confidential, anonymous, and discreet. So, that should put people's minds at rest that they can go. They're not going to be judged. Staff are very open. They deal with it as part of their jobs day in, day out. They have a lot of knowledge, expertise, and your information will not be passed on to your GP. Your information stays within the sexual health service and not passed to other parties. How do you get a test? It's quick and easy. You can get one by visiting the walk-in clinic. And in our case in Birmingham, that's provided by the Umbrella service. There are different clinics, and we've got the website for Umbrella later in the presentation, you can find out where those clinics are run and when. And you can also get a test from a pharmacy, an Umbrella pharmacy, and we've given the link there to find your local clinic or pharmacy. But you can also now order a test to your home online through the Umbrella website, or you can collect one from an Umbrella pharmacy. So we've tried to make it as easy as possible for people to access tests in the most helpful and appropriate way. The treatment, if you do a test, send it off, or at the clinic and it comes back positive, the main thing is not to panic. It's not the end of the world. Most STIs can be easily treated, and for those that can't, they can be managed. And I think this is really important for people to understand. When HIV was first identified. People saw it as a death sentence. It's not anymore. There are effective treatments, ways of managing it, but if you don't know you're HIV positive, then you can't access the treatment and support that's available. And that goes for other STIs as well. I mean, many of the bacterial infections like syphilis, gonorrhea can be easily treated with antibiotics. But unless you have been tested and have that diagnosis, they can't be treated. And it is important to get treated as early as possible. A, because it prevents them being passed on to other people, but also causing long-term complications. So getting tested as soon as possible will prevent this. So again, for example, chlamydia. Chlamydia is easily treated. It's a very common STI, but if treated, it responds very well. But if left untreated, can cause complications like pelvic inflammatory disease, which can lead to infertility. So it is important we pick up infections early so you can get appropriate treatment. So moving on, right, okay. Informing your partner of an STI. So during treatment, if you've accessed the services through Umbrella, they will support you in informing your sexual partner, because also obviously if you're infected and you've been having active sexual relations with a partner, there's a very high chance they will be infected as well. So these can be sensitive conversations in different contexts, and that's where the Umbrella service can help through what we call a contact tracing service. So they can help you contact a partner or anybody else that you may have engaged in sexual activity with to inform them that they might be at risk, and encouraging them to come forward for testing. And in doing that, they don't necessarily need to name you. So it is, again, a confidential service. But if you click on the link to Umbrella, it gives you more advice. But they do have a whole team. They're called health advisors, and they do a lot of the follow-up, the contact tracing, to try and break any chain of onward transmission. So can I prevent STIs? Yes. Yeah. Taking precautions, getting tested, as we talked about, being open and honest, talking honestly with potential partners, and taking and using physical barrier contraceptive methods, condoms, femidons, dental dams, and gloves. So moving on now to contraception. How are we doing for time? We're half past. So contraception, condoms is probably the most commonly known, one of the commonly known types of contraception, and the only type that can prevent against pregnancy alongside protecting against sexually transmitted infections. So it's important to talk to partners about using condoms, and understanding obviously that it protects yourself, but it protects others, and being confident in those conversations, because they may feel tricky, but if we see it as an important part of looking after our sexual well-being, it's really important to have those conversations. Suggestions here is just think about the timing, how to have the conversation, but also take responsibility for initiating and having those conversations. Other types of contraception, you may have heard of LARC, which is long-term reversible contraception, such as the intrauterine uterine devices, IUD, more commonly known as the coil. People might know it as that. So these are devices that are put into the uterus. They often have hormone implants in them as well. So they stop the egg um, embedding into the womb. So it is a long-term uh, solution, but also implants that you can insert into the arm, which are slow release hormonal contraception that stop a woman producing eggs. Then there's the short-acting reversible contraception, so the condoms, combined pill injections, patches and rings. And then finally, emergency contraception, so was commonly known as the morning after pill, and also intrauterine devices are also used for emergency contraception. So that is if you've had unprotected sex, you can access emergency contraception up to 72 hours after sex to prevent pregnancy. So now we want to consider how the whole issue of sexual health fits in with your role as a community champion and how you can help. And I think the main three areas that you can help is firstly about talking about the importance of sexual health and connecting people in your community with support through web pages and services. And very importantly, as you're having those conversations with people in your community, to feed back to us where more help is needed so we can continue to improve the support for citizens. So talking to people in your community, how do you talk to people about sexual health? Often it's a difficult subject and people don't feel confident in raising issues or having conversations, but it should be like having a normal conversation, even if it does feel uncomfortable. So to help make things easier, here are some points to consider. First of all, plan to have the conversation in a private space where everyone feels comfortable and no one's in a rush. Um, and really important to have open, honest discussions that allow people to understand expectations, boundaries, and very importantly, the whole issues around consent. And it also allows you to identify potential risks and ensure that people and we are all practicing safer sex. The more people that know about sexual health, the less people will avoid initiating conversations. And having conversations in a non-judgmental way improves mental health and well-being and allows people to be more comfortable with discussing sexual health. So talking to members of your community, we've just put in the circles here some of the questions that you might want to consider or might come up. So do you know about the different types of contraception available? So that's, giving information. Do you know what contraception prevents pregnancy? Do you have or your partner have good open communication? Do you know what consent looks like? How do you feel about getting tested for STIs together before we have sex? So that negotiation. And do you know why sexual health is important to look after? Do you know where you can order an STI testing kit from? Do you know where to get support if you're experiencing sexual abuse or coercion? And then, do you know when to take an STI test? So these are some of the common questions or issues that may arise when you're talking to members of the community and your community. And we've provided here a sort of framework that can help to provide brief support and interventions in your everyday interactions, discussions. And it's based on the model of ask, advise, and act. And this model is used a lot, not just about talking about sexual health, but it could be about any health topic, whether it's about wanting to quit smoking, or if people are worried about their drinking, or emotional well-being. So the first step is to ask, can I talk with you about relationships and sexual health? Do you know how to take care of your sexual health? What do you know already about contraception and STIs? And is there anything more you'd like to know? And then, do you know how to protect yourself? So you're really trying to gauge what people's understanding about the issue is. And once you've established that and found out a little bit of where people are coming from, the next step is to advise. So this is where you can use the information we've provided in this session to advise who you're talking to about. You can speak to your GP or sexual health clinic, and you can be provided with information of where to get test kits, condoms, contraception, as well as having other questions answered. And then the final step is acting. So having been advised, got information, find out more about actually how you can put that into action. So we've got the links there about how you can find out more about contraception, how you can order a test kit, where you can pick up free condoms, obviously umbrella clinics, pharmacies and GPs. And we've put the link there if people want to find out where you can actually go and act on what you've been advised or information you've been given. Those are the sources of where you can get support, test kits, information. And we've got we've worked through a case study, and there's two parts to this, really to show how that um, assist act model works. So Suki is a bolder, healthier community champion, frequently goes to a gym class with her friend who's recently met a new partner. So so it's, hi Suki, how are you? I've recently met a new partner and things seem to be going very well and I'm very happy. And in reply, it is, oh, I'm really glad you're happy in your new relationship. Did you know that you can get an STI test before having sex with a new partner? Which is what we've recommended earlier in the presentation. So that's the ask. And then the next part two, the response is, no, I didn't know that. Thank you for letting me know, but I'm too nervous to walk into a clinic as I'm afraid I might bump into someone that I know there. And then the response you might choose to use is, well, umbrella clinics are free, confidential, and your GP won't be contacted. So it's easy to do if you don't want to attend a walk-in clinic. You can also order testing kits to your home or pick them up from your pharmacy. So that's providing the information on how someone can act on the advice they've been provided with. So that's a useful technique to use when you're engaging in conversations. And as I said, that applies to many different health topics. And it's good to have in your mind those three A's: ask, assist, and act. And then the final slides, we're looking at connecting community members to the support available. So what we've done is given a series of links here. Firstly, most importantly, to the umbrella service, which is the sexual health services that we commission for Birmingham residents. It's free, accessible and confidential, and available throughout Birmingham and Solihull. And it provides information and provision of all different contraception, STI testing and treatment. And I really can't stress enough that this service is non-judgmental. It's for people of all ages, genders and sexual orientations, and everybody is welcome. And you don't need to see a GP first. You don't need to be referred. You can self-refer and you can just walk into a clinic or a pharmacy and access the services and advice on offer. And this slide summarises the resources available to you and your communities. And we've categorised it under the three areas that we talked about earlier in the presentation. So around relationships, informing a partner of an STI, the health advisors can help individuals to contact partners. There's a link there to consent, which we've mentioned earlier in the presentation, information of what consent looks like, the age of consent and further information. Then under sexually transmitted infections, the link to the Umbrella website gives a breakdown of all the different types of STIs, provides information what to look out for, how to recognise symptoms, although, as we've said earlier, not all infections you will experience symptoms. And then the NHS link there provides, again, a breakdown. And then the testing services of what's available through Umbrella. And similarly for contraception, there's a useful guide that Umbrella have to help you navigate between the different forms of contraception, and very useful frequently asked questions. And then the NHS contraception guide. So there is the NHS website full of information alongside the local Umbrella website and resources. So thank you for listening, and taking an interest in this area is an extremely important aspect to our health and well-being. And we do welcome your feedback so we can continue to support. So to email the team, Bolder Healthier team, and there's the information. So thank you very much for being a champion, and we look forward to working with you again in the future. We do have the monthly themed webinars, resource packs and training. So thank you for your time.